Today we're going to be doing dermatome testing, which is the ability to test sensation, which is important for patients that have stroke. So to start off with, you would ask the patient to open their eyes, and whenever they feel the cotton swab touch their skin, you would just have them say yes. So you would do that with their eyes open first, and then you would have them close their eyes. You would also start off with the unaffected side first, and then move to the affected side. Do upper extremity and then lower extremity. So I ask the patient to just tell me when they feel the cotton swab.
Yeah.
Okay. So the patient can feel, and from there you would have them close their eyes, and then you would test the dermatomes throughout the arm. So this would be C5, T2, T1, C6, C7, and C8. So those were the dermatomes, and then this is how you would go through it with the patient. So whenever you feel it, whenever you feel the cotton swab, just say yes.
Yes. Yes. Yes. Yes. Yes. Yes.
And then you would move to the affected side.
Yes. 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 Yes.
So now we're going to do the lower extremity. So it's the same thing. You would have the patient close their eyes and just tell me whenever you feel the cotton.
Yes. 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 Yes.
And it's important when you're putting the cotton on the patient's skin that you do not swipe, and then you just dab slightly. And that's it. Now that we've determined that the patient's sensation is intact, we can move on to testing for tactile neglect. To do that, you would have the patient hold out their hands and close their eyes, and you would move the cotton swabs in alternating patterns on their hands and fingers, doing one at a time, and also you would want to do bilateral stimulation as well, so both cotton swabs touching at the same time. And if the patient does not have neglect, then they will be able to feel both when you touch each hand individually and when you have both cotton swabs touching both hands at the same time. If they have neglect, when you go to touch both hands at the same time, their involved side will not have any sensation. So they'll only be able to feel it on the side that isn't involved. So it goes something like this. So whenever you feel the cotton swab on your hand, just say yes.
Left. Right. Left. Right. Both. 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 Both.
So this patient demonstrates that she does not have neglect because she was able to identify that the cotton swab was touching both of her hands at the same time. So now we're going to be testing for visual neglect. To be able to do that though, we need to identify if the patient has any visual field cuts. So to start off with, we would have the patient cover one eye with their hand. Whenever they see your finger move towards their field of vision, you would have them say now. And it's important to also make sure that they continue to look forward throughout the entire test. So whenever you see my finger come into your field of view, I want you to say now.
Now. Now. Now. Now.
Okay, good. So now we would have her do the same thing to the other eye.
Now. 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 Now.
Okay. Now that we've determined that the patient does not have any visual field cuts, we can move on to testing for visual neglect. So to do that, you'd have the patient continue to look directly at you, and you would bring both fingers up, and then you would move one finger at a time, and then ask the patient to identify which finger is moving. So
Left. right, left, right.
Okay. So the patient's able to identify which finger is moving. If the patient had visual neglect, they would have trouble identifying which finger is moving when you move them both at the same time. So,
Left, right, both.
okay. And that's how you would identify if the patient has visual neglect.
Okay, so today we're going to be testing kinesthesia, which is the ability to feel movement. And I'm going to start on the unaffected side, and I'm going to use the least amount of contact as possible. And I'm going to start distally and then move proximately. And I will tell the patient that this is the up motion and this is the down motion, and have them repeat back to me. What motion is that? Up. And that.
Down.
Okay. So now close your eyes and tell me if I am moving up or down.
Up, down, down. Up, up, down, down. Up, 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 down, down. Up, up, down, down, down.
Okay. And then I would do the affected arm, and next I'm going to do the unaffected leg. So this is up and this is down. What is this?
Up, down.
Okay, now close your eyes and tell me which motion I'm moving.
Up, up, down, down, down. Up, up, down, down. Up, up, down, down, up. Up, up, down, down, down.
Okay, and then I would test the affected side, lower extremity as well.